Hey guys, welcome back. If you are about to start Accutane or if you are in the middle of it but your skin feels like sandpaper, this video is for you. I'm a doctor but I have also been an Accutane patient myself. I took Isotretinoin for almost a year. And trust me, I learned the hard way that your old skincare routine can destroy you on this drug. So today I'm going to give you my complete skincare guide for my Accutane. What to wash with, how to moisturize like your skin depends on it, sunscreen, lips, eyes, and also a few other things that nobody talks about. Let's get into it. Hi everyone, I'm Dr.Chiyen. If you have watched my acne transformation video, you will know that I have struggled for severe cystic acne for years before finally starting Accutane. The medication completely changed my skin and honestly changed my life. But the journey wasn't easy. Like many patients, I experienced dry lips, skin sensitivity, redness, and emotional stress that came with the treatment. Today, I want to share practical advice that can help make your Accutane journey much smoother. And of course, this video is for educational purposes only and should never replace advice from your own dermatologist. Why Accutane makes you dry? First, a quick reminder. Accutane shrinks your sebaceous glands, the tiny oil factories in your skin. That's great for acne, but it also means that your skin loses its own natural lubricant. Your face, your scalp, your lips, even your eyes and your nose, everything dries out. Here is my personal experience. About 2 weeks into 10 mg of Accutane, my lips started cracking at the corner. I thought I could just use my regular lip balm. Big mistake. I ended up with cracking, irritable lips before I found out what actually works. So let me save you from that pain. Body washing. A lot of people think they need to scrub their body clean. On Accutane, no. While on Accutane, you should wash your body once a day depending on your activity level. Because the medication drastically reduces the oil production, washing too often can strip your skin barrier, leading to dryness, flaking, and irritation. Keep your routine gentle by following this rule. Showers quickly. Limit showers or bath to 5 to 10 minutes using lukewarm water or cold water. Hot water strips natural moisture. Pick mild cleansers. Avoid harsh, heavily scented, and acne-fighting soaps. Use a gentle, hydrating, fragrance-free body wash like Cetaphil Gentle Skin Cleanser. Gently pat your skin dry with a towel instead of rubbing it. Moisturize immediately. Lock in the hydration of your skin immediately by applying a thick, fragrance-free cream while your skin is still damp. One exception, if you exercise or sweat heavily, rinse off right away. Sweat can irritate the skin, so a quick rinse after a workout is an exception to once a day rule. Face cleansing. Wash your face only once a day with a gentle cleanser, ideally in the evening, to remove sunscreen, dirt, and makeup. In the morning, you can just skip the cleanser and splash with lukewarm water. Do not use anything for oily skin. No foaming cleansers, no benzoyl peroxide, no salicylic acid. One of the biggest mistakes that I see people make is continue to use acne cleansers while on Accutane. Remember, Accutane is already treating acne from the inside. You don't need harsh scrubs, strong exfoliants, and aggressive cleansers. Choose a gentle, non-soap, fragrance-free cleanser. During my own treatment, I learned that less was more. The more I tried to fight with my skin, the more irritated it became. A gentle cleanser and patience work much better. Moisturizer type. Before we dive deep into moisturizing, let me give you a quick tip that took me way too long to figure out. Not all moisturizers are created equal on Accutane. You have 3 main types of moisturizers. Lotion, too light. That will evaporate off your skin in an hour. Creams, your new best friend. Thick, rich, and actually stay put. Ointments like Vaseline, extremely greasy, best for spot treating peeling areas like around your nose and lips. Here is what I learned the hard way. In my first month of Accutane, I kept using my old oil-free lotion. My skin felt tight and flaky within 2 hours. I thought the drug wasn't working. Turns out I was using the wrong texture. Once I switched to a thick cream, everything changed. So remember, lotions are out, creams and ointments are in. Now let me show you how to moisturize exactly the right way, starting right after the shower. Moisturizing. This is where the magic happens. Let's go. Forget your old oil-free, lightweight lotions that will not work. You need greasy, thick, occlusive creams. Many acne sufferers spend years trying to avoid moisturizers because they are afraid of becoming oily. Then suddenly they started on Accutane and discovered the opposite problem. Your skin becomes dry, tight, flaky, and uncomfortable. Look for moisturizers that contain ceramides, glycerin, hyaluronic acid, and petroleum jelly. Application tips. As soon as you step out of the shower, apply the moisturizer as soon as possible while the skin is still slightly damp. Don't wait until your skin is fully dry. Use this on your head to toe, yes, even on the scalp if it gets dry. Lips. Let's talk about the side effect that almost every Accutane patient experiences. Dry lips. For me, dry lips are the only major side effects that I experienced throughout my 1-year course of Accutane treatment. I was fortunate not to develop other symptoms like dry eyes, back pain, or any other symptoms. But my lips definitely needed constant attention. You need a petrolatum-based ointment multiple times a day. Avoid anything with flavor, fragrance, essential oils, phenol. The safest option is 100% Vaseline. Vaseline is an excellent dermatologist-recommended occlusive that can protect and heal the dry, chapped lips. Because lips lack their own oil and sweat glands, applying a thin layer of Vaseline can help to seal in the moisture and help to block out the harsh, dry environment elements. I apply a generous layer of Vaseline every night before going to bed to deeply soothe my lips while I sleep. In the morning, I apply a thin layer of hydrating lip balm instead, so I don't get too messy from applying thick Vaseline during the day. Sunscreen is non-negotiable. Accutane makes your skin extremely vulnerable to UV damage even through windows. You need a broad-spectrum mineral sunscreen that contains zinc oxide or titanium dioxide. Ideally tinted because tinted sunscreen helps to block out visible lights, which helps to prevent dark spots from healing the acne. Apply sunscreen every morning, and if you are spending your time outdoors, remember to reapply. Protecting your skin also helps to reduce post-inflammatory pigmentation from your acne. The sunscreen that I use daily is Skin Aqua Physical Sunscreen Lotion. Eyes. Your eyes can get dry like sandpaper, especially if you are a contact lens user. Stop using contact lenses while on Accutane. Swap to normal glasses. Use preservative-free artificial teardrops throughout the day. If you use artificial teardrops more than 4 times a day, preservative can irritate the eyes. I recommend using Refresh Optive preservative-free single-use vials. You can store them in the fridge. It feels amazing. Alright, that's the complete Accutane skincare survival guide. Let me leave you with this. Accutane changed my life. My skin is not perfect. I still have scars, but I no longer hide. The dryness is temporary, but the result can last. If you are struggling right now with Accutane, dry, peeling, uncomfortable, know that it gets better. Just keep greasing up, protect yourself from the sun, and be kind to yourself. Don't forget to subscribe. I have more videos on acne scars, post-Accutane maintenance, and everything about skincare. Drop a comment below. What is your biggest struggle while you are on Accutane right now? I read them. Thanks for watching. See you in the next one. Bye.